Good morning and good afternoon. I'm Barb Poppy. I'm calling in from Columbus, Ohio, to launch this webinar on healthy parents, healthy babies. I am thrilled to be joined by my partners in this work, who will be also presenting with us today. Julia, Rodrika, Natalie, and Caitlin will all be joining. We are very excited to present this new report that we have been working on over the last number of months. Next slide, please. We would be very interested in knowing who is joining us on this webinar. So if you could use the chat and include in it your name, your organization or agency, if applicable, and where you're calling in from. What's your location? We're also going to do a pop-up poll to get a sense of who is joining us on this. So when that pops up, we're going to ask you to let us know your connection to the work of healthy parents, healthy babies, and your day job. Give everybody a couple minutes to enter into the chat and respond to the poll. It's great to see friends and colleagues from across the country signing into the chat. And it looks like we're getting from the East Coast to the West Coast and everywhere in between. So thank you all for joining us. Got a few more folks jumping in there. Want to, at this time, just thank Kim and the National Low-Income Housing Coalition for hosting this webinar and making the technology possible, as well as for supporting this work. I'm going to let Kim, you can decide when we should close out the poll because you are able to see what the votes are coming in and when it's ready. Great. It looks like we have a mix of folks who work on policy making, a large number of you folks calling in from the homelessness and housing sector. Glad to have our colleagues calling in from the maternal health and services sector, and then the rest of you from various sectors. Appreciate the time you have with us today. So thank you for that. And let's move on to the next slide. So this project is a part of the work of the Framework for an Equitable Homelessness Response. We are a collective of national organizations and experts. We were launched early in the pandemic to address both the public health and the economic crises that were happening to people experiencing homelessness and the inequitable impacts that we were seeing on folks who were in particular Black, Latinx, and Indigenous communities, as well as people with disabilities or other underlying health conditions. So we have been working since the beginning of the pandemic together. And the next slide gives you a sense of all of the national organizations and experts that have been a part of this, encouraging you to check out the website and see all the materials that have been developed. We continue to work together as a collective because of our commitment to more equitable responses to the housing and health crises that continue to face our country. Next slide. So this project, Healthy Parents, Healthy Babies, was established to document and disseminate strategies to reduce racial disparities, increase housing stability, and improve maternal health, birth outcomes, and child health associated with homelessness and extreme housing instability among women and families of color. We believe these recommendations highlight an equitable approach to working with families of color to reduce racial disparities as they work to access housing, healthcare, and community support. The report specifically includes some first-person perspectives, so you have a deeper understanding of each of the policy recommendations and where they came from. We have recommendations, and those are described in ways that also provide examples of policies and programs that could advance the recommendations. And then finally, we selected two programs to profile that give you some background on programs and how they are approaching housing and healthcare. Next step. So our report is really grounded in our vision, and we believe that all parents should be healthy and able to provide for their children, and all babies should be born healthy and thrive as infants. We've created this report for policymakers at federal, state, and local levels, for all types of decision makers who impact the lives of families and their children. This includes state Medicaid plans, public housing, continuums of care, and others who finance or fund health, housing, and other services. And importantly, this report is also intended for those organizations that provide these services, housing and health, and are focused on meeting their unique needs as pregnant and parenting people. Next slide. As we began this work together, we knew that there were deep racial disparities in who experiences homelessness. While just 12% of the US population identifies as Black individuals, however, account for 37% of all people experiencing homelessness, and half of people experiencing homelessness, half of the people who are members of families experiencing homelessness. So deep racial disparities in this. These racial disparities are also prominent in maternal and infant health outcomes. We know that Black women are significantly more likely to experience both maternal morbidity and mortality. And we have and it has been documented that being homeless while pregnant is harmful not just to the mother, but also to the infants. And we see much higher rates of pregnancy complications, as well as preterm and low birth weight deliveries and other health complications that can have long-standing impacts on people. And then we know that even the briefest amount of experience of homelessness, whether it's prenatal or postnatal, is associated with adverse child physical, mental, and developmental outcomes. And these are the type of impacts that have lifelong consequences for those children who experienced homelessness at such an early age. Next slide. And I am going to pass this off to my colleague and friend, Natalie. Take it away.
Thank you, Barb. I appreciate that. So we started this project in March of 2023. My team and I recruited across the country to find people who wanted to share their stories about their lived experiences being pregnant and struggling with housing instability. Our focus was to develop policy and practice level recommendations from each person's lived experience. During the hours that we spent together, we supported one another emotionally and intentionally focused on rooting all of our recommendations in experience. Barb was able to recruit policy and research advisors who reviewed our original draft of recommendations in April, and an additional policy-driven lens to provide specific asks and examples of existing efforts related to our recommendations. So our lived experience committee came back together to finalize the report and ensure that everything they wanted readers to understand and learn about was presented in the final version of the report. Next slide, please. So on this slide, we are able to see a map of the US, the names of the LEC members and their locations across the US. Each committee member brings a unique experience based on their geographic location alone, stretching from Florida all the way to Washington State. And throughout this presentation, we hope to listen, reflect, and understand each lived experience committee member stories, the barriers they face, and what they are here really asking for you to learn about the experience of being homeless, being a homeless pregnant mother in our country. Today, we are lucky to have Julia and Roderica join us. Over the presentation, they will be sharing directly with you about why these recommendations are not only important, but how they connect to their personal lives. Next slide. So now I would like to transition into beginning the discussion of our 8 recommendations. Our first recommendation looks at the need for education of trauma-informed care practices in both the healthcare and community settings. This emerged from our lived experience committee members who shared and related on experience where they have felt humiliated, guilted, and shamed during intakes and requests for help. The LEC emphasized the need to take an upstream approach of preventing trauma through investing in early intervention methods so that they are not putting people in a position of only receiving help when they are in crisis. In addition to prevention, they want to ensure that we mitigate trauma by having all staff working with pregnant people and families to recognize the importance of going into every situation with a trauma-informed lens to reduce community harm and ultimately build trust. Next slide. Thank you. Recommendation number 2. For our second recommendation, LEC members emphasized the need for dealing with the housing and income during prenatal period. They reported that being without income during this period happens because they didn't have paid leave, but couldn't work since they needed to take care of themselves and their newborn. When they lose income, they also can't pay for rent and can be evicted. The ideal would be having ongoing rental assistance, but even shorter term crisis assistance would be helpful. The most critical need extends from pregnancy to a postpartum period that could extend a year or more after birth. Next slide. And I am going to hand this over to Roderica.
Greetings. Thank you, Natalie. Thank you. Hello, I am Roderica from Columbus, Ohio. I am currently in subsidized housing and live in the metropolitan area with my 4 children. They age from 3 to 13 years old. And I just want to express my gratitude for resources like CMHA that is available, to me and my children. So I'm truly grateful for that. And I am here today because I believe that housing is just the tip of the iceberg. I strive to give my kids the opportunity to thrive and blossom. However, there are barriers that come with that, such as anxiety. Just from the idea or the experience that I had when I was a child, that my housing could be stripped away, for arbitrary reasons. That's what happened to my mother, when I was younger. And so because of that, I deal with that anxiety or the fear around that. While housing has to be safe and equitable, so do the neighborhoods where we live. Like right now where I'm at, there's a concern for gang violence in my neighborhood, which influences, how I parent and the limitations that my children have, their opportunities to go outside and play, and just be, kids. And as a mother, this is very, sad, frustrating. And I am a part of this movement for my family and for others. And I increasingly feel like an empowered voice for women and children. Thank you, Natalie.
We'll move to the next slide, and Rodrika, you can share recommendation number 3.
All right. So recommendation number 3, okay, is the design, is to design quality housing with an equitable lens. And so this is just to increase investments to build and preserve quality, affordable housing. This would provide rental assistance at a scale that eliminates racial disparities and provides choice and, I always get that word, autonomy for Black, American Indian, and Latin people. This also enforces fair housing and disability protections.
We can move to the next slide. Thank you, Rodrika.
Thank you, Caitlin.
Yes, thank you, Rodrika. So I want to share a story about a lived experience member who cannot be here today, but contains a powerful story related to our recommendations being shared. Ariana explained that in her first pregnancy, she spent time living in her car. As a means to survive, she found herself not only experiencing domestic violence, but also getting caught up with the law and losing custody of her first daughter. She ended up with a criminal record, and even after taking the steps to change her life and get her daughter back, it seems almost impossible for her to find stable, independent housing. Ariana was ultimately able to connect with a caseworker who was able to advocate and work with her to search high and low for stable housing. So having stable housing since has changed Ariana's life. Ariana recently gave birth in August to her second baby girl, has her own space, and is fighting to regain custody back of her first daughter. She also gives back to her own community and tries to connect mothers in similar resources. Her journey has been anything but easy, and her passion is to advocate for more supportive community spaces and resources for moms in similar situations to hers. Next slide, please. Black and brown mothers are far more likely to be evicted from their families than other families in similar circumstances. For landlords, an eviction record is the equivalent of carrying a criminal record. Our LSC members believe that emergency rental assistance should be readily available in every community to help pregnant people and families avoid eviction. We heard how traumatizing it was for them to be evicted and how they worried about the negative consequences for their children. The LEC recommends that the importance of finding more ways to prevent eviction and also reduce the potential for any discrimination based on sources of income or other factors like a history of eviction, poor credit, or criminal justice engagement. Thinking about Ariana's story and how finding stable housing changed her trajectory in life, imagine how it can do the same for others. Next slide.
Thank you, Natalie.
You're welcome.
As we resonate on what we've heard so far, I'd like to share another one of our lived experience committee members' stories, Destiny. When Destiny was 21, she was homeless with a newborn. She spent night after night trying to find a safe sleeping environment for her child until she reached a breaking point with couch surfing after having to stuff a milk crate with blankets to mimic a crib for her baby. In addition to struggling to find safe housing she could afford on her own, she could not find affordable childcare based on the single person's income she carried. In her life story, she explained that understanding how to navigate the system was not easy, and many times resources that could not have really helped her were not openly shared, or resources that could have helped her were not openly shared. Today, Destiny works with families in the social service sector to connect them with resources in the Indianapolis area. She believes that having 24-hour access to support could have changed a lot for her and her circumstances. Next slide, please. So we move on to recommendation 5, which looks at extending the time frame for cutting off public assistance and benefits and being able to provide more gradual intermediary step downs. One lived experience committee member shared that when she went back to work after giving birth and had received less than $1 pay raise, she lost some of her benefits, even when she still needed them. And this experience was traumatic for her. She began to question and doubt herself, even though she was trying to improve herself and her family circumstances. So being able to work on oneself should not feel like a privilege in this country. Next, the Lived Experience Committee stated that this should be covered, or all assistance that mothers could be using to support their own efforts in keeping their family afloat. Next slide, please. Given that each lived experience committee member lived in a different section of the country, we were able to learn about the differences in accessibility to different resources based on what their state's Medicaid covered. The LAC wants all pregnant people, parents, and children in every state to be covered with a comprehensive Medicaid package. They want more screenings and treatments for postpartum depression, more support to get to and from medical appointments, and other things that help them and their children become happier and healthier. They talked about the need for easier access and a longer time to receive these services, noting that being pregnant can be stressful for everyone, but when you're homeless or housing insecure, that the stress can become unmanageable and lead to things like depression. Next slide, please. Sometimes a pregnant mother goes through screenings for resources, only to find that the resource is not available, the phone number doesn't work, or no one is there able to respond when they're in crisis mode, making them feel defeated and at a loss of where to go next. Their seventh recommendation is about the importance of expanding awareness and access to programs and resources for this population when they are in crisis. LAC members shared that not only was it hard to find resources when they were available, but they also couldn't figure out whether or not they were eligible for these resources. We also know that resources may not be at a scale of need. So the Lived Experience Committee members will also want to share or see a better continuum of resources that provided maternal health supports and housing resources in a more integrated way. They felt like it was hard to both find the resources they needed while also trying to take care of themselves and their pregnancy and children, while also trying to figure out how to have a stable home. We heard that programs were often organized for people who had stable homes and didn't have as many challenges as they faced while living potentially in a shelter. Next slide, please. I'm going to pass it on to Julia to share her first-person perspective.
Hello, my name is Julia, and I currently live in a shelter in the Seattle, Washington area, and I'm a proud mother of a beautiful baby girl who just turned 1 year old. I've struggled with being able to parent my child in the way I want due to the challenging conditions of living in a shelter. I've been here for 7 months and experienced many challenges, including issues with privacy, noise levels, and managing a healthy routine for my child and myself. I was assigned a housing case manager to help me, but she treated me more like another number in her caseload rather than a person with feelings and potential. Though the barriers I'm experiencing have led me to experience anxiety, I am hopeful and optimistic that my current situation can change with all of your help. I'm here today because I believe in a better tomorrow. Gaining genuine support and having the ability to make choices for myself and my family is important for me and for mothers like me in the United States. Next slide, please. The next recommendation is recommendation number 8, which is to build 24-hour support programs and centers for new parents. Develop a fun community-based support and programs designed and tailored to provide round-the-clock 24-hour services specifically to improve the outcomes for postpartum people and their partners who are pregnant or are transitioning into parenthood. Community approach, community organizations, faith-based groups, volunteers, and peer support organizations. Basic needs, mental health, and connections to community resources. Staff included nurses, doulas, and peer support specialists. This last recommendation highlights the need for 24-hour support programs and centers for new parents. Similar to Destiny, I find this recommendation to be important and connected to the ways that will support mothers who are in similar situations to ours. Having specialized care and space for mothers can help with their postpartum needs, especially their mental health and their ability to produce milk for their babies. Many shelters, like the one I'm staying in, don't provide help with on-site childcare and prohibits you from letting other community members in the shelter watch your kids while you're doing things like taking a shower or needing to meet with a caseworker or to run simple errands. It does take a community to raise a child, and bringing them along with specialized staff can make a huge difference in the way mothers are able to continue to go back out into the world every day and fight for a better life. Thank you, Natalie. Oh, is it Caitlin?
Okay, we're gonna go to the next slide, which is our call to action.
Julia.
Julie, I think you're muted.
Yeah, sorry, I had muted. Sorry. These are real policy recommendations, but more importantly, today I hope you are able to see how you and your work can help be part of the shift in our country and how we treat unhoused pregnant mothers. I really hope you see us today and recognize that you can play a role in how change can be made. Thank you.
So babies are born every second, but under what circumstances? Pregnant women, especially Black women and women of color, lived in an invisible space where they were overlooked, and the only times that they were recognized or called upon is when they are being used for their ability to survive, the resilience to withstand, and the love they give. What happens when they say, I am tired of fighting to survive. I want to fight to live, and I want to come together in a space where they can use their personal experiences that say, I am not invisible. I don't want to just survive. I want to live and thrive. This is what happens. Policy change.
Radrika, do you want to read your last line as well? You're muted, my dear.
Can you hear me? Okay. So our hope today is that you can take the right steps in building policies just by simply listening to us and hearing out our needs. Thank you. Thank you, Caitlin.
Thank you, Radrika. Thank you, Julia and Natalie. And thank you all again. Barb, would you like to continue on to the next slide?
So we're going to turn to you, our audience, and invite you to share with us your comments, your questions, and any clarifications that you want. And as you're thinking about what questions you might have, I'm going to just remind you that in the report, as I mentioned, we've included a couple of program profiles. One of those is based in Washington, D.C., and they are working on improving both prenatal and perinatal outcomes during for women who are experiencing homelessness. And we encourage you to read about the work of DC's Community of Hope. The second project is based here in Ohio. It's called Healthy Beginnings at Home, and it is building the research and evidence base to show that providing housing during pregnancy to homeless and housing unstable women can improve birth and health outcomes for both the mother and the child. If you want to learn more about the work of Healthy Beginnings at Home here in Ohio, that profile is in the document. Healthy Beginnings at Home is being replicated in other states across the country, and be happy to share more about that if you have questions on that. So let's move to the next slide, which is our question and discussion. Thought I'd kick this off, and I think Rodrika, if you are willing to unmute yourself and come online, the question I have for you, is there anything else that you want people who are watching today and participating to understand about this project and your experience in it? Anything that you'd like to also share, Rodrika?
Thanks, Barb. Can you hear me? Okay. I just want to share how I became a part of Healthy Pregnancies, Healthy Baby Project. Is simply just by experience. I used to complain, literally used to cry, and just blame other people, the government for lack of accountability and, just for the secret hidden, agenda of the racism and, racial disparities. And so I just became tired. I just became tired of doing that. And I was just decided one day, I said, I'm going to be the change that I so long for, that I so long, to see. And really just to make the next, person's journey a slight easier, than what I had to go through, right? And this opportunity really just came to my front door by way of a previous lived experience committee, Shantae Mills. And yeah, I just fell in love with the mission. I fell in love with the idea, and I know that I'm not alone, and I'm not the only one dealing with this. And I just want to be the voice, right? For that one that is afraid to speak up, for that one that is afraid to take the necessary steps to make change. I want to be that one. And so that's why I'm here. And I just also want to share a little bit of detail about the recommendation 3. I actually forgot that. It's looking at designing quality housing with an equitable lens. And so with this recommendation addresses the need for giving us a choice in where we live in a city, and it builds diversity in all spaces in our cities, not just in the sections of towns that, have the highest crime levels in failing school districts. And we believe this will require more funding to build and to preserve housing that is truly affordable. We should have the right, and when I say we, women of color, pregnant women, we should have the right to live without experiencing housing discrimination based on our race, family size, or disability. And I was that one. And so I just am here, hoping you would just hear and do what you can on your part. Thank you, Barb.
Thank you, Rodrika. Really appreciate your energy and leadership and commitment to be a part of this project.
Absolutely.
This our project manager, who kind of kept us all together across the project and handled recruitment and bringing together the lived experience committee, is our colleague Natalie. And Natalie, you've had a chance to really reflect on the project, and I wondered if you might want to share any takeaways that you have from this experience that others might think about as they look at the report and they think about bringing that home. Any reflections or takeaways you'd want to share with them about the process or the recommendations?
Thank you, Barb. I appreciate that. So I jumped on this project, and the only thing I really had was I was completing my bachelor's degree and lived experience. And I brought with me my own experience, and it was my own scope of what homelessness, was or is. In recruiting and speaking with these lived experience committee members, even while I was doing interviews, learning their stories, I realized, I come to realize that everybody has their own barriers and not every story of homelessness is the same. So it really, this project is so dear to me because it really the one thing that really got to me is that this isn't just, a today problem. This has been decades. We had a LEC member who had experienced generational homelessness. One who had been homeless while she was pregnant in the late 1990s or early 2000s to now, experiencing on and off again homelessness. And in their stories, their barriers just, it feels like there was always like a missed, we could have did something about that, we could have done something about that as a nation. I mean, it's a constant, that should have been something easy to correct, or or provide, or whatever the case. And so this is the time where we have put so much, where rent prices are so high, people are being priced out, and supply and demand is, there's not enough housing for everyone. And this is a time that we have shed so much light on it because of COVID, and everybody's seeing the problems. Like, we need housing. Everyone deserves to have housing. And so what I'm taking away from this is the anticipation that everyone who is here today, does their part in seeing what we can do for correcting the things that need to be corrected.
Thank you, Natalie, for those thoughts, as well as your tremendous work on this. I'm going to kick it back over to the Seattle to Julia, and just ask Julia if you've got some thoughts you'd like to share that you haven't been able to share yet, as folks look at the report and think about what to do next.
Thank you, Barbara. Having lived in the shelter for the past 7 months has been a very, very eye-opening experience for me. And because I am in the shelter till right now, I came in the shelter in February with my child when she was about going to 5 months. And it has made me to rethink homelessness and the needs for women who are pregnant and who have small children, even bigger children in the shelters. I came into homelessness from a different kind of perspective, not the traditional one that a lot of people think of homeless, because I have a master's degree. I used to have a long career that I enjoyed and hoping to get back to. I used to give to homeless shelters. I used to volunteer a lot, and I still will once I'm housing stable. I believe that through sharing my story, we can make a difference to the next women who are going to end up in shelters pregnant, especially pregnant ones. Because living here for 7 months, I've seen women come in, give birth, and being discharged from the hospital and being returned to the shelter, which is not equipped properly to take care of such a vulnerable time of a woman's life and a child's life. And I believe that our stories can help you policymakers change the lives of how homelessness and housing stability should be handled. I believe that women don't have to stay in a shelter for that long before they are housed. There should be a place where women can go and be taken care of, because we are facing a housing crisis, yes, but a place where they can be properly taken care of, not coming back to a shelter that has so many mixed bunch of people, and their needs are completely different from women with small children or just pregnant women. So I hope that you can really hear our voices, hear our stories, and help us be the change for the next people who come after us. And thank you so much for listening to us.
Wow.
Thank you, Julia. Really appreciate you and your thoughts and your call to action. I'm going to turn this, give Caitlin a chance to jump in here. She's done a lot of the work to pull the report and the presentation and get us all ready to do this webinar. And Caitlin, you've worked locally in communities, and when you think about the recommendations that are contained in this report, what do you think are the most important things for local programs to consider implementing as we move forward? Any thoughts to share?
Thanks, Barb. And I just want to say that I'm so grateful that I've been able to be a part of this journey and to not only work with Rodrika and Julia and Natalie, but also our other lived experience committee members who were not able to be here today. And when I think about the recommendations that are most important, in transparency, Barb, the only thing I can say is all of them. When you consider the concept of implementation, well, when you start, even let me move further back to needs assessments within your direct areas, I think that this project is a great example of understanding how uplifting, and listening to voices in your community can help really stabilize and support the implementation process of programming and policy recommendations that can focus on a local and even state level. I think really just being able to hear these stories today, my biggest goal in regards to programming is just also the recommendation of trauma-informed care. I know that this is something that's becoming more of a raised importance for all people to be trained in at local agencies, but just really emphasizing that need of being able to meet people where they're at, and recognizing that if we start there, then we can go so much farther and get them to even farther places in their lives, and then also within the work that we do. So if you can look at our report, the full report kind of divides out public program or programmatic recommendations as well as policies. But I think that this recommendation of just listening to voices can really extend to both, especially even on a state level as a policymaker, being able to really recognize and support your constituents and allow them to really inform a lot of the work that you're doing can really, again, draw and bring in farther change than we can all imagine. So I hope that that answered your question, Barb.
Thank you, Caitlin. Really appreciate you. And again, thanks for your work on this. I'm going to begin taking some questions that I'm seeing in the chat and the Q&A. I just want to add, as a reflection I have here, is that details really do matter. And what I learned from our lived experience committee members, and as they struggled through the coming up with recommendations, is that too often, I think, as policymakers and providers, we are fairly broad brush and just assume that we're going to be able to meet the needs, and not thinking about the very unique needs of a person who is pregnant or has an infant, and what are the unique needs that are there, and that's where details matter. So even just the issue that was raised was a place to store breast milk in a communal refrigerator. That's a detail that makes no sense, because it does not offer safety and security that the breast milk will be there, that it'll be safe, and that it will be able to be used for the baby. So that's one detail, but it's a really important detail. And there are so many details that we learn from speaking directly as you look through these recommendations about the places that programs and systems have been designed, but there's just a lot of gaps in them. And I think we really need to look, as Caitlin said, all of the recommendations are really solid, but notice also the details within there as it applies to this very specific population of people experiencing pregnancy and those with young children, particularly with infants. And if we really say that motherhood and infants are the treasures, I think we can do a much better job treating them with the kind of care and support that they deserve. Tremendous resilience and advocacy and leadership came from the women who were part of our project, but it shouldn't have been that hard on them as it was. So thank you all for considering that. I saw a question in here, which was about what about the role of fathers? And did we identify resources for fathers? Caitlin, I saw you nodding. Would you like to take a shot at that? Is what, when we talked about the role of fathers in this, what did we learn and how do we handle that?
Yeah, great question. I think in our time spent with the lived experience committee members, we did have a deep discussion around not only fathers, but I think there needs to be a raised awareness around caregivers, how that can extend to things such as grandparents, you know, just close friends, family that are really taking the time to support mothers throughout their experience of pregnancy. We did identify some resources that connected with fathers, but I think that's again another thing that the report we kind of share very briefly, but just more work needs to be done around supporting a family unit. So in the report, you'll hear the term of really talking about things like family stabilization. And we do reference back and forth, not only the mother and the newborn, but their families. And that's really connecting back to this picture of how do we continue to support individuals like fathers and caregivers in this space. And from just community resources, there may not be a lot in the report kind of listed, but I do know that more agencies such as public health agencies and then local agencies as well are really taking efforts to have programming just specifically around fathers as well, because we also do want to uplift and raise awareness around the fact that there are single fathers that are working towards their own housing stability and having newborns as well. But for the purpose of this report and just looking at the lived experience community members, we really kind of focused on our mothers and their experiences. Barb or Natalie, do you have anything else to kind of add on that?
No, I think you said everything.
Thank you. A next question or just a comment that was in there was about connections with OB and other prenatal and perinatal services. Applaud those of you who are bringing those to participants. I think you can see we've got a number of recommendations. I also would call your attention to the Community of Hope program profile. They are a federally qualified health center, and so they are approaching this not just as a family shelter housing provider, but through their FQHC lens. They have indicated to us that they would love to collaborate with others across the country who are working on the maternal health side and trying to bring these types of services into shelters, into housing, and to partner across that. So if you want to in particular be connected, I encourage you to be in touch with Community of Hope and the work they're doing as a federally qualified health center. And there was a question in here about methods of communication. Our lived experience committee talked a lot about the lack of knowledge that the lack of information that's available about community resources and how hard it is to figure out what they're really eligible for. And you can see that's a specific recommendation, but that also shows up in a number of the other recommendations. So the question that came in through the chat says, which channels, social media, in-person handouts, word of mouth, do you feel are most effective for getting information out to expecting parents? And I'm going to turn this over to Julia and Rodrika first to see if either or both of you have some thoughts on what are the most effective means of providing information. Would one of you want to jump in and start on that, and we can let the other go next?
I can do that. I am reminded of the conversation that the team and I had, Barb, about such resources like that are available to women to be placed in the doctor's offices of the OBGYN. So as they're going in, these women are going in for appointments, there's resources there, for them that are outside of the doctor's office. So I know we were considering something like that. We're still in the making, in the process of figuring all that out. So that's there.
Thanks, Rodriguez. Jill, you want to add something?
Yes, I think for me, handouts have worked very well here in the shelter, but most of them are not translated to the dialects of the women who are here. So we can have so much information. It's all in English. But we have people who speak Tigrinya, people who speak Spanish, people who speak Spanish, at least a lot of the material is translated to. But those other languages, it's very difficult, considering that most women in this particular shelter are immigrants. So if it's pamphlets, but with translation, that will get to the women well, they will know. And having pictures, I've seen that pictures work very well when the language is not available, because they can make sense of it.
Thank you. Natalie or Caitlin, anything you would like to add?
Yeah, I definitely want to uplift and echo Julia and Rodrigo's recommendations around, the location of where resources are being handed out, and also the approach of language justice and all of the work that's being done as it relates to providing resources. I also think that this is again, when we talk about this report, there's this integration of like housing and healthcare systems. So to Rodrigo's example around getting resources from the doctor's office, being able to have that awareness of understanding the housing systems and the supports and needs. We talk a little bit about that even in like the preterm screenings around questions that can be asked, whether it's by social workers or by intake officers around like, what is your housing situation? How are you, do you have somewhere to sleep at night? And kind of being able to go more into detail to fully understand the housing situation, as well as vice versa, potentially in a housing service sector, kind of asking questions around, if there is prenatal support or if they are able to get to and from their appointments. And I think, again, if you look at our program profiles, DC Community of Hope is a really great example of an FQHC that has that integrated approach. So just thinking again about not only what like the resources overall, but what resources specifically. And then when you talk about channels, I think all of these are great examples, but again, your community best. I think really coming from different places of urban down to suburban and even some of the rural connections. In my community work that I've done, I think handouts have worked great, being able to be on the ground and with feet. But we also know that sometimes too, having more hotspots and free Wi-Fi, people do have social media and outlets to kind of utilize as well. So being able to take that step to just have all the exhaustive resources and word of mouth is so critical. And I think it's also an intentional approach based off of a lived person's experience in that specific program. So if the program goes really well, not only is that word of mouth sharing that resource, but it's also uplifting that, hey, that experience with that nurse really changed my day, because she didn't just ask me about my healthcare needs, she also asked me about my whole person approach and my experience. So I think, again, all of these can be great work and great examples, and you can always divide and conquer around those channels, but really also asking your community what they need can be really beneficial.
Thank you, Caitlin. I want to thank, there's a question in the chat that comes in from the Minnesota Indian Women's Resource Center. They were one of the organizations that participated in our convening with the research and policy advisors and our lived experience committee. And today they're bringing up a great question about how does the report address the systemically denied rights and socioeconomic opportunities that has been a large part of homelessness as it relates to Indigenous, Native American, and African Americans, and recognizing the importance of historical and structural racism to prevent more trauma and homelessness. I'm going to see if Caitlin, if you want to jump in on that one, and then others to follow. So Caitlin, any reaction to that question? Thoughts?
Absolutely. And thank you so much, Domi, for that question. I think thinking from also a lens of being a community health worker, community provider, and even a medical social worker at one point, when you describe the historical and structural racism within your question, I think that really resonates with me around the programmatic and also the personal steps that need to be taken as we're building trust and authentic relationships within our communities. I think that if we look at all of these recommendations from a whole, where we really should be able to start, and that's more of like, again, that really acknowledgement of understanding the historical harm, not only on this national level, but even on community levels. I work on a day-to-day basis with communities across the state of Colorado, and I hear about how, while the structural issues have really made an impact on their communities, really understanding the historical context of what was going on in their communities too, has really been able to take the time to really tailorize how much restoration needs to be done to even get to a place of being able to work in the community. So I think like on that scale, I just wanted to be able to acknowledge that as well. This whole report is really, we are taking the time to look at the history, and we're also looking at the present day history of all of our lived experience committee members and how they've also been affected through structural and systemic racism and issues across our country.
Thanks, Caitlin. Anyone else want to add to that from our group? All right, I'm scrolling up and realize I missed a question. The question was coming in about, is there help out there for couples who are homeless and pregnant? I really want to thank you for that question, because one of the things that we learned in this work as we talked in communities, and then there was also some work that some of us did through the National Alliance to End Homelessness conference this summer, and that was learning that in every community, it seems there are different definitions of what qualifies as pregnancy and families and how they access homeless services. So in some communities, families are considered two adults without children. Other communities, a family has to include one minor child and an adult. So it really does seem to vary. This has huge impacts for people who are pregnant as to what their family configuration is and how they're able to access services. So in some communities, if you are a pregnant person, you're only considered a family once you leave the hospital, then you can access a family shelter. In other communities, it's if you can prove your 3 months, your end of your first trimester, then you're considered a family with children. So it really is a huge gap because there's not a universal definition of how people can access those services. And when we think about people who are pregnant, their needs are distinct and unique because of the pregnancy that they're experiencing. And so the fact that the way they access services depends on how a community defines pregnancy and family is absolutely, I would say, insane. I'll just give an example from here in my community of Columbus, Ohio, is you're a family with children only if you have a minor child, but if you're pregnant and you're a single and you have a partner but no other children in your family at that time, you in fact have to separate and enter the single adult women's shelters separate. If your partner is male, would have to enter the single adult men's system. So that breaks apart the family. And there's a bunch of rules about the different ways you access it. So it's kind of embedded in our report across the recommendations. But the experience I think that we all brought to this was every person who is pregnant, regardless of their family configuration, should receive the services and the housing that they need. And unfortunately, that is not happening in any uniform way across the country. And it's certainly not clear in any of the policies that are out there, that the policies seem to further separate families rather than really value the importance of bringing the entire family to be supported. You can even look at Medicaid. The Medicaid rules, as I think it was Caitlin made this observation, is that they varied across all 50 states. And they vary in terms of who's eligible for services within the family and the length of time that they receive that. So in no way are we, in a universal way, treating all families in an equitable approach. So that I flagged that one. Anyone else on the team want to jump in? Feel free to go and do that, and I'll be looking for some other questions here in the chat.
Yeah, I can jump in on that. It was so what comes to my mind is our lived experience committee member Destiny, who is out of Indianapolis, and at the time, her and her partner were both homeless and couch surfing, and when she was able to get into a shelter, but it was overpacked and everything, and through her story, she was always, saying, if we could have been housed together once the baby was born, I could have had that extra support. I could have had someone, help me out. I could have, been able to take a shower or, so it affected her mental health being separated. I think oftentimes, we always want to help out the woman and child, but if, it's taking, I guess, the family approach that Destiny was, looking for at her time of need, a family approach, because she's saying, hey, I'm pregnant, but he's my partner and he wants to help, but we're both homeless. And it's that feeling of separation from your only support system at the time.
Thank you, Natalie.
Can I add into that too, Barbara?
Julia.
I've also seen in the shelter that I'm staying in where there's families where, because it's a women and children's only shelter, who are separated. There's families who are separated from their fathers and from their husbands, and seeing the children, how they're growing, having seen them for like 7 months and how they keep talking about their dad. They keep saying things about their dad. It's as if their dad is dead, like he's no longer there, but they're there. So we are adding extra traumas to these children. They have to go to school, come back, and they don't have somebody to help them do homework like a normal family would. You'd get one of the parents probably help. So we're not doing it right. We need to fix this. Let's keep families together. Let's stop re-traumatizing the children. And policy change can make a difference there.
Thank you, Julia. I think I've gotten through all of the questions that I could see in the chat. If I have missed a question, please go ahead and throw it in there right now, and we will try to answer that. We appreciate your time today. Caitlin and I both provided our emails. Feel free to reach out to us. We again want to thank the National Income Housing Coalition for hosting this webinar, for also the Framework for an Equitable Homelessness Response for hosting our project. We want you to know that all of the slides from today are posted to the website, and the recording will be shortly. So if you want to share this with your friends and colleagues, please do so. We encourage you to download the complete report and use that report in your work locally, and reach out to us and keep in touch with us if we can in any way support the work in your community. We'd love to share what we've learned because we, speaking on behalf of all of us, we are all very committed to making things better for all people who are pregnant and struggling with housing and homelessness, and making sure that all babies are able to thrive and the parents and the family do well as well. So thank you again for all of your time with us today. And is anyone else on my team want to jump in and say any last words? Feel free to do that.
I want to say thank you for listening to us, and I hope you're going to team up with us to make some good changes in housing for pregnant women. Thank you.
Yes, thank you for your time. Thank you for listening, and I'm excited for the future. Thank you for the role that all of you play.
That's all. I'm so grateful for being here today as well. And I cannot be more grateful for my team and Julia and Rodriga just for being so amazing in this presentation and taking that step to being able to share their stories. So I hope you were all listening as well.
Likewise, I thank everyone for taking the time to listen to our lived experience committee. I want to thank Barb for this vision of hers to bring this report to everyone. And I hope that we continue to learn from lived experience so that we can make solid change.